The next global outbreak, a wake-up call for humanity. Imagine this, a deadly new disease emerges in a distant, isolated region. At first, it seems contained. But within weeks, it spreads, fueled by climate shifts and mass human migration. Borders vanish before the pathogen's power. Now, the question isn't if, but when, this scenario becomes real. We've seen this before: SARS, Ebola, COVID-19. Yet, the stakes are higher than ever. Changing climates drive animals and humans into closer contact, creating new breeding grounds for infectious diseases. And as people move across countries, diseases travel faster than we're ready to manage. Are we prepared for the next big one? The effects of climate change are more than rising temperatures. Melting ice is releasing ancient bacteria, while warming climates allow disease-carrying insects like mosquitoes to invade new regions. Regions once safe from deadly diseases like malaria could see outbreaks soon. Extreme weather events force millions to migrate, overwhelming healthcare systems and crowding cities. This increases the chance of a disease spreading unchecked. In a world already stretched thin, could we handle one more global crisis without collapsing under its weight? Migration is both a survival strategy and a disease accelerator. Refugee camps, urban overcrowding, and limited access to healthcare all create perfect conditions for outbreaks. Diseases don't respect borders, and without early detection, they spread silently across nations. Airplanes, buses, and trains move millions daily. A single infected person could directly or indirectly expose hundreds, maybe even thousands, in hours. The idea of faraway diseases no longer exists in today's interconnected world. COVID-19 disrupted our lives, but it also taught us crucial lessons. Preparedness saves lives. Global coordination matters. Early action is better than scrambling after a crisis. Yet, despite these lessons, much of the world still lacks the infrastructure to combat a new global outbreak. Imagine a disease more contagious or more lethal than COVID-19. Without preventive measures, it could devastate lives, economies, and nations on an unimaginable scale. The time to strengthen health systems is now, not after the disaster strikes again. The good news is that we can act. Climate policies aren't just about saving polar bears, they are about reducing the risks of disease outbreaks. Investing in vaccine technology, global surveillance networks, and better healthcare isn't optional, it's essential to protect our future. Each of us can push for change. Support leaders who prioritize climate and public health. Learn how diseases spread and take personal steps like vaccination and fundraising to help vulnerable communities. Together, we have the power to prevent the next pandemic. We're racing against time. Whether it's climate action, healthcare reform, or migration planning, every second counts. The next global health crisis could arrive tomorrow, and only a united effort can stop it before it begins.